I wish I could make this up.
Yes, this is a very real side effect of some blood pressure medications. I'm Dr. Frita. I'm a board-certified high blood pressure doctor and kidney doctor. And yes, I have seen this side effect in some of my patients who take this blood pressure medication. And unfortunately, some of my patients have passed away. So please listen up and spread the word. This is called angioedema. It is a rare but potentially life-threatening complication of certain blood pressure medications. Which ones? ACE inhibitors, angiotensin converting enzyme inhibitors, lisinopril, benazepril, ramipril are some examples. Now, if you are taking one of these ACE inhibitors, please don't curse out your doctor, don't run and throw the bottle away, because truth of the matter is that it's a very rare complication. It only happens in about 0.1 to 0.7% of the population, but if it happens to you, oh, that percentage seems very large. Angioedema occurs when you get a swelling of mucous membranes, particularly in the lips, the tongue, in the larynx, okay, or your voice box. And it can happen pretty rapidly, typically within weeks or within the month of starting a medication like lisinopril. But in some cases, you won't get angioedema until months after or even years after. The symptoms are lip swelling, okay, getting really huge lips, almost like a caricature of yourself, a huge tongue in some cases, an itching or discomfort in your airway. You can get a really hoarse voice, a cough, a stridor, okay? When it is caused by the blood pressure medication, it typically won't cause the itching or the urticaria. What are the risk factors for having this side effect? Being Black. Okay, if you are of African descent, then you are at a higher risk for getting angioedema. Also, if you're over the age of 65, if you're a smoker, if you're taking certain immunosuppressant drugs like transplant medicines, tacrolimus, if you are a person with allergies. Oh, also, if you've ever taken an ACE inhibitor and you've gotten a cough, okay, a cough from this blood pressure medication, you might be at an increased risk for getting angioedema. So the medication actually blocks the breakdown of something called bradykinin. When this bradykinin builds up, then in some cases, if you are genetically predisposed, it can cause you to get this lip swelling, this tongue swelling, this angioedema. So very importantly, what do you do? If your lips start swelling, please don't sit around and contemplate and say, wonder what this could be. Seek medical attention immediately. Call your doctor, and if you're having trouble with breathing or trouble with swallowing, things of that nature, call 911. The important thing is to stop the medication immediately and get to a doctor. I've had patients who've had to be in the ICU. Some of them didn't make it.